Vaccine that is targeted against the two most common HPV types associated with both presentations. Two most common types, type 16 and 18, that are most commonly associated with cervical cancer and the most rapidly progressing cervical cancer are in the vaccine, as well as the two types that are associated with genital warts. With any vaccine, the theory behind using a vaccine is to not eliminate the disease except in rare exceptions. With HPV, because there are so many different types of virus that we want to try and, if we target those four, we can eliminate 80 to 90% of disease. So you have a very effective vaccine against those four agents instead of trying to make a vaccine that's effective against 12 agents that may have less activity against other components.
So it's the 4 out of the 15 down below?
No, these types are only the wart virus. These don't cause cancer. They cause cutaneous lesions. They cause, in the most severe form, this sort of presentation. Okay.
Yes.
Can't help you there.
If you have any young kids that you want to impress appropriate sexual activity, that is waiting until an appropriate age, using appropriate birth control, barrier precautions, I know of no better way to get the point across. So those two types then are associated with those cutaneous lesions. These two are associated with cervical cancer. Okay? For cervical cancer, then, it is a combination of Pap smear plus our newer molecular test. And about somewhere between 80 and 90% of the samples we get into the clinical lab for Pap smear, we also do our molecular test for the genital HPV strains. Prevention, barrier precautions, vaccines, monogamy, abstinence, the same litany that is associated with prevention in all of the sexually transmitted agents. Besides bacteria and viruses, yeast infections, a fungus, and there's two types of fungi, the molds and the yeasts. Candida albicans is a yeast that normally colonizes either the oral or the genital mucosa. Factors that affect the normal community in that mucosa then can lead to overgrowth with an organism like Candida albicans when the normal bacterial population is affected by antibiotics, other factors. And then a protozoan, Trichomonas vaginalis, can also be sexually transmitted. Trichomonas can cause urethritis, can cause disease in both males and females. Unfortunately, in males, it is very commonly asymptomatic, so the diagnosis in males doesn't occur with anywhere near the frequency that it should. The infections in females are more symptomatic. This is what the organism looks like. It is a protozoan, so it is a eukaryotic organism. It's relatively large. It's going to be somewhere in the range of 25 to 30 micrometers in size. So we don't have to use oil immersion magnification to see it. In fact, we can use a 10 or 20x objective with just a wet mount to be able to easily identify this organism. It does have a flagella. Again, a different structure than the flagella we talked about with bacteria, because this is eukaryotic. But The purpose is the same for motility. This is what the organism looks like on wet mount. You can see the flagella, you can see the nuclear region in the eukaryotic organism. Unfortunately, diagnosis by microscopy is relatively insensitive. You have to have a significantly high number of organisms present before they can be seen on a wet mount with a microscopic exam. And historically, this has been the way that Trichomonas was diagnosed. We've moved to more sensitive types of lab tests. There is a immunologic test called an enzyme immunoassay, similar to the rapid strep assays, where you can take a swab specimen, put it into a tube of saline, and then take some of that saline and add it to a cartridge that has antibody that will capture the organism, and then antibody that will allow you to see a visible color change to diagnose positive infections. Same types of prevention. Because it is a protozoa, it is treated with not the typical antimicrobials that we use for bacteria, although for whatever reason, antimicrobial that's active against anaerobic bacteria, a drug called metronidazole, Flagyl is the trade name, is also active against the Trichomonas, the eukaryote. Our yeast, Candida albicans, yeast are unicellular organisms. This long structure here is called a pseudo-hyphae. It results from some of the individual yeast cells that don't reproduce by budding, but they produce this long structure without division. So it's called a pseudo-hyphae. In the vaginal mucosa, this organism then can produce a variety of symptoms resulting from antimicrobial use, where the antibiotics affect the normal colonizing bacteria, leading to overgrowth. Frequent douching, eliminating the normal microbial community, can lead to overgrowth with this organism. There's a variety of factors that can lead to what's called vulvovaginal candidiasis, yeast infection. There are both over-the-counter and prescription drugs that can be used to treat those infections, both topical and oral drugs that have activity, although they can take varying amounts of time to be effective. And then lastly, the human immunodeficiency virus, HIV, that causes the clinical syndrome AIDS. AIDS is an effect on the immune system due to replication of one of the subpopulations of our immune system. Once that subpopulation of cells is suppressed, then the host becomes susceptible to what we call opportunistic infections, infections that our immune system would normally fight off. Like organism that causes respiratory infection, a protozoa, Pneumocystis carinii. Pneumonia caused by this organism is relatively uncommon. The way that the AIDS epidemic was first recognized was that the drug that is used to treat this organism is only available through the Center for Disease Control. And it was recognized by epidemiologists at CDC that there was an unusually high number of requests for this particular drug from the San Francisco area, resulting from increased number of cases of pneumonia and predominantly the gay male population, where HIV infection first took on. And then the other population that initially was infected were hemophiliacs, where it was transmitted through blood transfusions. because we didn't know the virus was even existed, the blood supply wasn't screened for the virus. As a result of that epidemiologic investigation, then it was ultimately discovered that this new virus presumably made its way from other primates to humans, was the cause of this immunosuppressive disease, and then ultimately a lot was discovered about the virus, and now there are multi-drug regimens that are directed towards suppressing the various phases of the virus: replication, infection of cells, etc. Again, infects the CD4 subpopulation of our T cells, and when that is suppressed, that leads to immune deficiency. There is now combination drug therapy that will affect the HIV virus population to the point that it can be suppressed to levels that are at the lower limits or even below the detection limits. So it's a relatively sensitive molecular assays, and that's really what the drug therapy is targeted to. You keep the virus at very low levels. That allows for your CD4 T cell population to maintain a healthy level so that the immune system isn't suppressed. Questions?